During the 2024 Maryland general election, voters will be asked to amend the Maryland Constitution to guarantee the fundamental right to reproductive freedom as a central component of an individual's right to liberty and equity. Some have referred to the ballot measure as the abortion amendment, but the word abortion is not in the amendment. Let's take this opportunity to review the language to better understand what you are voting on. The amendment is brief and has only 2 sentences. It sounds great. Why wouldn't everyone support an individual's reproductive rights? But there is a problem. Let's take a closer look at the proposed amendment and focus on what it does and does not say. The proposed Reproductive Freedom Amendment applies to every person. We rightly have age limits for driving, voting, drug and alcohol use, but there is no age limit specified for reproductive freedom. If the amendment had stated men or women instead of individual, then this amendment would have only applied to persons who have reached the age of 18, which is when the state of Maryland recognizes an individual as an adult. Since the Reproductive Freedom Amendment lacks any age requirement, it applies to minors as well as adults. Legislators have specified age limits for new rights in the past. For example, Maryland voters passed a ballot referendum in the 2022 general election, making it legal for individuals aged 21 and older to possess and consume cannabis in Maryland. The amendment states that every person has the fundamental right to reproductive freedom. It provides no definition of reproductive freedom and explicitly states that it is not limited to preventing, continuing, or ending one's own pregnancy. One should never vote for anything that is not worded clearly or is confusing in its language. Legislators had multiple opportunities to narrow the amendment to abortion, but chose not to. The amendment will create a constitutional right for medical decisions related to reproduction or reproductive anatomy. Preventing one's own pregnancy could include medical treatments such as cross-sex hormone treatment for gender transition that causes irreversible sterility. That's not a decision an adolescent has the maturity to make, especially not without the knowledge of their parents. There are no parental consent or after-the-fact notification requirements. Attempts to amend the wording to add age limits and parental consent requirements as safeguards for minors were rejected by legislators. An amendment to the Maryland Constitution creates a new standard. Current and new laws that abridge these new reproductive rights, such as imposing any age limits, would be challenged, require passage by the General Assembly and ratification by the voters to be passed. Cost cannot be a burden, therefore Maryland taxpayers will bear the cost of these new rights for residents and others who enter our state for the constitutionally guaranteed services. As you decide on how to vote on a reproductive freedom amendment, please consider the following. Terms such as reproductive freedom are not defined. One should never vote for legislation that is not clearly and concisely stated. This amendment goes far beyond abortion rights. A no vote to this amendment would allow parental involvement in the life-altering reproductive decisions of their children and help protect children from harmful gender transition treatments. A no vote upholds the family unit. Caring parents can influence the outcomes of their children and not face the risk of having their children removed if their decisions do not align with the state. Gender transitions involve many steps, including multiple surgeries and a lifetime of medication to suppress natural hormones to maintain gender appearance. All of these come at a great cost that will require taxpayer funding if this amendment passes. Whether the Reproductive Freedom Amendment passes or fails, abortion for any reason through birth will still be legal in Maryland. Your vote matters. You have until November 5th to decide.